Really what we're about is about being there for your patients, and whether that's an acute condition, whether that's chronic maintenance, whether that's being there for them in the happy moments and the sad moments. And I think that's really what we provide as family physicians, and I think that we do that at St. Elizabeth really well.
It's not dependent on what school you went to or how good your grades are, it's how much you care.
It's treating the patient, but it's also treating their family members as well, because they're involved in their care. Really discussing with them why we're doing the treatment plan that we have. Are you okay with it? And what other modifications can we do?
That's where the art of medicine just comes into play, that two different doctors may do something differently, but they're both valid and appropriate treatments.
When I hear that a patient doesn't want to see anybody else and they want to see me, I know that they trust me.
It's not only the helping people, but it's really that interaction you have with them. It's that connection that you have with them. And it's what I love every single day. When I leave, you're exhausted some days, but then you think back on it, you're like, it was a great day.
I think that's probably one of the best things about this job is the gratification you get from a patient telling you how you've changed their life or you've made their life better.
When looking into things like a fellowship, the fact that St. Elizabeth had the OB fellowship available, as well as the connections that St. Elizabeth would offer, was a huge draw.
Even if you're like myself and you have a good idea of where you want to go, but you want to be broadly trained, this is the place to be.
When you graduate from this program, you could do outpatient medicine, you could do inpatient medicine and become a hospitalist or nocturnist like myself.
In the span of a couple of hours, I had to admit a patient, I intubated a patient, I did a central line, and I delivered a baby. No other type of specialty can do all of those things in one night, and the fact that as a resident I get to do all of those things in one night is pretty spectacular.
I came to this program knowing that I'd be broadly trained, and I'll be going into a practice that does pretty intense inpatient care as well as traditional office-based ambulatory care.
I plan on doing outpatient medicine. I like the variety of patients that you get to see, so from newborns all the way to geriatrics. That's why I went into family practice, and that's what I want to do after residency.
The community needs that I'm seeing, I plan on getting my Suboxone prescribing license to be able to treat a lot of people who are suffering from addiction in the area, which is a huge problem throughout the country, but certainly in our area as well.
Often they're struggling through something specific. I've had patients that are cancer survivors that are now, they have a new cancer scare, and you get to be the one to be like, stop. We're gonna get through this together. I'm not gonna send you through this alone. I'm here for you every step of the way.
I had one patient that I actually delivered her baby and was taking care of her father, her elderly father. I could tell over the months he was getting a little sicker, and he eventually was septic in the ICU. I had to have some very frank conversations with him and his wife and his daughter. Eventually, we decided to go a comfort care route. I was lucky enough to have enough time that night to really just sit with them and be present with that family that I've cared for every family member, including his grandchild, up until the end. And it was very emotional for me, but also there was just a feeling of deep privilege. That is truly the spirit of family medicine, to be the person that is able to stitch this giant quilt of medical care together and let it be cohesive, make it all make sense for that family, and let it be whole.